Okay. So if you understanding the provider query concept, then only possible to answer the question. So what is the meaning of provider query? Query means
Doubts, questions.
doubts, questions, good. Then so what doubt? What question?
regarding the laterality.
Regarding?
Laterality.
कौन सी documentation के लिए?
Mhm.
For
Conflict
confirmation of
of-
diagnosis.
Confirmation of diagnosis.
Yeah.
When we need to confirm. So remember, suppose if you are unable to find, like you are able while reading, you are confusing to select the diagnosis whether codable or not. Can you raise the query?
Could you please
While you are reading the document, you are confusing for the diagnosis, you need to code or not. Document was perfect, but still you are confusing.
No need to raise.
No need to query.
Okay? No need to. Now, our document was really conflicting.
Raise query.
Document insufficiency.
Raise query.
raise query?
Okay. Raise the query. If the document was insufficient, you need to raise the query. Now, suppose when we need to raise the query, tell me now exactly. Note down conflict to documentation. Okay, really document was conflict. Insufficient document. Okay, insufficient document. Insufficient document, conflict document. Then they mention the clinical indicators, like document mentioned, but they didn't given the like treatment of the particular condition. They given only condition name. They didn't given any diagnosis workup of the particular condition. Then can you code that condition? No workups. Suppose simply they mentioned page pulmonary embolism. There is no workup for that pulmonary embolism entire document. Can you code?
No.
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 Then they give an entire diagnosis workup, but diagnosis missed. Based on the workup, can you code diagnosis?
No.
No,
No.
sir. No.
No. Conflict, inconsistent, incomplete document. So if there is no complete document, we can't able to code, right?
Yes.
So in these situations only we need to raise the query. If document was perfect, okay, you are able to difficult to identify the condition, don't raise the query. Okay, you need to clarify with your superior or like supervisor or quality analyst, whoever may be. Okay, so if there is need in the document, definitely then only you need to raise the query. Okay, so next guys, types of queries. Acha, tell me for whom we need to raise the query.
Attending physician.
Okay. So remember here, provider query means you need to raise the query always for attending provider or attending physician. Okay. Raise query always for whom? Attending provider or attending physician. Same meaning. Suppose in the document have a pathologist and attending physician. For whom you will raise the query?
Attending.
Attending physician.
Attending physician. Okay, always remember, enter the document. If anywhere conflict also, you need to raise the query for only attending patient or attending provider. Why we need to raise for only attending provider or attending patient? Why we should not raise the query for pathologist or consultant or nutritionist or some other?
Attending provider is handling case for particular patient and for billing purpose.
Mm-hmm. Suppose, see guys, yeah, yeah. Suppose, yeah, yeah.
Physician,
Listen carefully.
physician notes annual symptoms of the patients. That's when.
Mm-hmm. Yeah. Suppose if the patient was admitted in the hospital, they are staying in the 10 days. They, for the patient, only one physician will check or multiple physicians will come and check?
Multiple.
Multiple. Suppose if one physician was admitting, then radiologist will come and they will take x-rays and all. Now pathologist comes and they will review the lab test. Consultants daily will come and they will check the certain specific, like nephrologist means nephrology related. Their consultancy they will follow. They all give the summary, right? Their summary they will give. Then who will review that summary? Attending physician. Correct? Who are admitting that patient should be owner of the patient. Who are admitting to the patient for the hospital, that patient should be the owner of that patient. He was the responsible for person to that patient. Okay, everything they need to take care from admitting to discharge. They need to review the entire document for the patient condition, everything. Radiologist, if they come and they will give some diagnosis directly based on the radiologist record, we should not come to conclude, right? Again, the patient will review that X-ray report and they need to confirm that no, whether patient have really have that condition or not. Yes or no? General hospital, you can check. Okay. If you go to the hospital, one person admitted, then radiologist coming based on the X-ray, they said, some you have fracture. Can that patient will start the fracture treatment immediately based on the radiologist report, or they will review that X-ray?
He will review X-ray.
Physician will review and they will confirm, no? They will get conclude, right?
Yes, sir.
Okay. So now remember. So whoever the responsible are admitting the patient, that's the admitting patient or attending patient. That's the responsible of that patient. Okay. In between pathologist, everyone will come and go. Okay, so don't raise the query for pathologist. Suppose document conflict in the pathology, don't raise to pathologist. Document conflict in the radiologist, don't raise to radiologist. For this all summary, you need to raise the query for attending provider or attending patient. Okay. So now tell me who will raise the query? Who was the person to raise the query to patient? Medical coder, right? Who are doing coding, they need to raise the query. Okay. Remember. Now, types of query. First, written query and verbal query. Written query means
In documented form.
documentation form. Okay, they will give certain template. You need to fill that template. Okay, you need to send that query, like what are the issue, what are the concern you have on the particular document. You need to fill that template and you need to send back to the patient. Okay, documented format. Okay, you need to fill through electronically. They will give certain template. Then verbal means voice. Okay, you need to call or you need to record the voice and you need to share to the physician. Verbal query. So nowadays everyone following written queries. There is no verbal query. Okay, clear? Verbal query and written query means?
Yes, sir.
Yeah. Thank you. So next, different types of queries we have based on the similarity or situation. Based on that, you need to divide the queries types. So first one, POA indicator query. So POA indicator query. When we need to raise the POA indicator query? So guys, when the document coder adding U indicator, right? Coder unable to identify the POA status, what indicator you need to use?
U indicator.
U indicator. So U indicator adding means what you need to do? He or she must be send the query to attending provider for the POA clarification. So remember, while the document was incomplete, to adding the POA, you can add U and send to the query to physician. If provider will give reply based on that, you need to change the status of the POA. Suppose if provider states I don't know, then what indicator you will add?
W.
W. If they said Y, you need to change Y. If they said N, you need to change to N. So any doubt in the POA indicator query?
No, sir.
No, right? Thank you. Next, specificity query. So guys, remember, while you are working on the inpatient, you need to follow the specificity. Okay. As per the ICD index, while leading the code, you find more specific codes. Okay. You find more specific codes for the particular condition, but they give an unspecified diagnosis in the record. What you need to do? You need to raise the query for
Specificity.
specificities. For example, they given respiratory failure in the record. For respiratory failure have more specific codes, right? In the ICD index. Yes or no?
Yes.
Yes,
So
sir.
what are the respiratory failure specificity conditions? Tell me.
Acute chronic.
Acute, chronic,
Acute, chronic,
hypoxic.
chronic. Okay, with hypoxia, with hypercapnia. Okay, different specificities we have, no?
Yes, sir.
Yesterday, I think we seen one question also, right? Exam. For which condition you will raise the query? Yeah, third question, check.
Yeah, second, raise the query, acute or chronic.
Yeah, because
Acute
see, they
failure.
given only respiratory failure in the record, correct?
Yes.
Okay. Why? Because respiratory failure have more specific codes. That's why in this scenario, what condition raise query means respiratory failure. See, patient admitted with CHF decompensated. They are saying CHF decompensated. Then respiratory failure and COPD is exacerbated. Both are treated and patient have these are history condition like DM type 2 hypertension dementia. Okay. So now for which condition you will raise the query? Respiratory failure. Because specificity missing. What query you need to raise here? Specificity of the respiratory failure. So please confirm whether patient have acute respiratory failure or chronic respiratory failure or acute and chronic respiratory failure. Okay. Specificity missing. Suppose if they given only CHF in the record, what we need to do? They didn't mention type of
Type
CHF.
of systolic or diastolic.
Yeah, you need to mention all the types of CHF and you need to ask the specificity of the CHF. Okay. So patient have the condition unspecified in the record. Specificity missing. But in the ICD index while you are reading, for that condition have more specific codes. So you need to raise the query for specificity of the particular condition. It called as specificity queries. So remember, in inpatient maximum, we should not use unspecified codes. Okay. Maximum, you need to try to code specific code. Any doubt? Specificity?
No, sir.
This respiratory failure question clear right now, everyone?
Yes, sir.
Yes, sir.
Then laterality query. What is the meaning of laterality?
Specific location.
Patients.
Side.
Side.
Right, left.
Laterality means right or left, right? Upper or lower, right or left, specific location. So when the documented conflict between the city, okay, right side or left side missing. Suppose guys, in the record, header states X-ray right knee, radiology report heading. In the X-ray right knee radiology report, they mentioned in the impression left knee osteoarthritis. The diagnosis is acceptable.
No.
No.
No. Why no?
Because in the same with left knee and
Laterality is
impression.
both mentioned. We not confirmed.
So here laterality was missing, right? If they given heading right knee X-ray means how they will identify left knee osteoarthritis, correct? While they're taking X-ray on right side, they need to identify the right side diagnosis means acceptable. If they mention left knee osteoarthritis, it was acceptable. Is there some lack of documentation, right? Somewhere, whether maybe X-ray they taken from left or they done by mistakenly mentioned diagnosis was left. Okay. Somewhere documentation was missing. Clear? Huh?
Yes, sir.
So that time, what you need to do? You need to raise the query for laterality. Don't raise the query for acuity. Raise the query for laterality. Now I will ask one question. Pain. They didn't mention right.
Sir, your voice is breaking.
Sorry, bro. Sorry. Sorry. So, in the record, they mentioned knee pain only. They didn't mention like right or left or bilateral. Now, what query will raise? Laterality or specificity?
Laterality.
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 Specificity.
Here, you need to raise the query for specificity, guys, not laterality. They missed the specificity, right? They didn't mention right, left, bilateral, nothing they didn't mention. They given unspecified condition, no?
Yes, sir.
So you need to raise the specificity. So you need to raise the query for specificity. When you need to raise the query for laterality, remember, they will give right and left. Okay, one side, one place they documented right, one place they mentioned left for the same situation. Other right, left. Document some for the same diagnosis they given one place right, one place left. Okay.
Okay, sir.
Yeah. So guys, now I will ask one more question. Patient have right distal radius fracture. Okay. Patient coming with right distal radius fracture. Procedure not documented. Splint applied on the left distal radius. How we will code in this situation?
Laterality, sir.
Laterality.
Yeah. You will raise the query for laterality, or you will code diagnosis as per right, procedure as per left, both as right, both as left.
Raise query for laterality.
Laterality query.
Laterality query. Okay. They will give options like this. Okay. Code both as right, code both as left, code as per diagnosis right, code as per procedure left, query for laterality. In this concept, we will get 3 questions. Remember, laterality concept. This is one question. What we discuss now, fracture. Then they will give right carotid artery stenosis. Procedure performed on left carotid artery. Procedure not documented left carotid artery. Laterality.
Laterality query.
Laterality.
Okay, patient have right breast adenocarcinoma. Procedure not documented left mastectomy.
Laterality.
Laterality query. Okay, laterality query. Clear? Huh? So when the document right and left. Hello? Bola na?
If the provider is not mentioning right or left, then we have to assign a specificity, right?
Exactly. Specificity missing means specificity query. Okay.
Okay, sir.
Missing the specificity query. Document insufficient, like conflict between the site right or left, then only
Laterality query. Okay, sir.
laterality query. Okay. Good.
Sir, for specificity, we have to take acute and chronic. ఇంకా ఏం తీసుకోవచ్చు సార్
Specificity, acute తీసుకోవచ్చు, chronic తీసుకోవచ్చు. If they didn't given any specificity, like particular condition have unspecified, but the code have more specific, you can take as specific. Like if they given pneumonia have different types of specific, like aspiration pneumonia, viral pneumonia. You need to identify the specificity like that. Okay, not only acute, chronic.
ఓకే సార్
Based on the condition have different. Only respiratory failure have acute and chronic. If CHF, if you take, you need to raise for systolic, whether it was diastolic. Okay, depends on the condition. Specificity, they will change. Okay.
What if the documentation state unspecified to amputation? Then we can go with unspecified code, no? No.
Amputation.
Unspecified Toe amputation.
Toe amputation. So you need to check right which toe, either right or left, like right foot or left foot.
There
See
is
guys,
no
there is no document, then query. So while you are leading a procedure in PCS, have you checked unspecified toe code? You leaded detachment, right? There is no option in the unspecified, right?
Yes.
Okay, there is no option unspecified in the PCS. You don't get unspecified. If they done procedure for hand, if they didn't mention right and left, you can check hand unspecified. No. In PCS, all are specific codes only they given. If specificity missing, you need to get the clarity. You need to get query. We don't have unspecified toe amputation code also in the PCS.
Okay.
Okay.
Now clear.
So definitely we need to get the specificity. Have you checked?
In case
We
of
don't have unspecified also. Yeah,
in
tell
case
me.
of DM we can file in, sir. We can go
For the
directly to type.
type 2 default, it was a ICD guideline, right? If they
Yes, yes.
mentioned unspecified DM, you can go with type 2 DM. They are given clearly ICD guideline, then there is no type here. Okay.
Okay, sir.
As per ICD guideline, they are clearly mentioning no unspecified means select type 2 DM. Okay.
Okay.
So laterality clear, right? Right and left conflict. You will get questions like right carotid artery stenosis, left carotid procedure, right breast adenocarcinoma, left breast mastectomy, right radial distal fracture, left distal radius fracture procedure. Query for laterality. In specificity, you will get respiratory failure. In POA, you don't get any question.
Sir, your voice is
Sorry. In POA, you don't get any question. Okay.
Okay, sir.
In POA, not any question not came, sir.
You don't get any question POA related. Okay.
Only specificity and laterality questions are there.
Lot of questions there. Up to now, I am saying.
your voice.
Okay.
Sir, Y indicator, N indicator. This,
Yeah. Why and I shared the video already. Okay, you can go with that video.
No, sir.
Y and N related. Huh?
No, sir, but I am
Yes.
asking you Y indicator, N
Bolo.
indicator. Not
Y indicator, N indicator.
not
No. You will get Y and N indicator related questions. You will get POA query related. You don't get that. I am saying. Y and N indicator. You will get questions.
Yes.
Okay. Y and N question POA related, they will ask what is the POA. What I'm saying, you won't get query related. POA query related, you don't get. Okay.
Okay, sir.
POA related questions you will get only Y and UW. POA query you don't get. Next query, pathology query. Okay. Conflict document between the pathologist and attending patient. Pathologist and attending patient. Suppose patient coming with liver mass. Okay. Admitting patient taken biopsy and sent to the pathologist. Pathologist reviewed liver adenocarcinoma. Documented liver adenocarcinoma. So now you will code adenocarcinoma or mass.
Mass query for.
Okay, so check. Compared to mass, adenocarcinoma was the more severe condition, right? Cancer was the. But it was documented by pathologist, not confirmed by the attending provider. So what we need to do, you need to raise the query for attending provider related to pathology report. So whether pathologist documented adenocarcinoma, please confirm whether patient have adenocarcinoma or not. Okay. You should not code directly mass. So you need to raise the query for that path report. Okay. To attending patient review. Then, if the based on the attending patient review, if they reviewed and they confirmed adenocarcinoma, code adenocarcinoma. If they ruled out that adenocarcinoma, go with mass, like this. Okay. So not only pathologist, guys, remember any like nutritionist or any consultant, documented condition compared to physician. So both are conflicting. Then attending patient was not reviewed. Okay. That condition was not shared. Then what you need to do?
Raise the query for attending physician.
Query for attending patient. Okay, only for attending patient. Suppose conflict between the attending patient and surgeon, what you will do?
Sir, yes, query for surgery.
Rise query.
Now only I said always raise the query for attending patient. Now if you say
Attending
surgeon means. See, if there is no attending patient, then you can raise the query for surgeon. Sometimes, if the absent of attending patient, surgeon only act as attending patient. Sometimes what will happen? Surgeon only will attend, admitting surgeon only will do the procedure, everything will take care of the surgeon. At that time, you need to raise the query for surgeon. If there is no
Attending physician.
attending patient, okay, if they have both have attending patient and surgeon, then query for attending patient only. So now I will give some examples related to pathology review. One question, see, when creating a complaint query to clarify conflict information from the surgeon and the attending patient, to whom you should raise the query?
Attending physician.
Attending physician, okay, not surgeon. Remember. Twenty-sixth question. Patient has findings suggestive COPD on chest X-ray. The attending patient mentioned the X-ray finding is one progress note, but no medication or no further evaluation. What you need to do? Okay, they mentioned there is no treatment about COPD. They only documented on X-ray.
Query for attending physician.
Query for the attending patient
Physician.
for X-ray. 27. If patient undergoes a inpatient procedure and the final summary diagnosis is different from the diagnosis of path report, what you will do? Like final summary was mass, path report was adenocarcinoma.
Query
for
the attending.
attending physician.
Attending patient, okay? So now you understood, right? Pathology query.
Yes, sir.
Yes.
Thank you, guys. So next important query, clinical indicator query. These clinical indicators you need to remember. Okay? So what is the meaning of clinical indicator? Means clinical indicators are nothing but sign, symptoms, treatment options, diagnostic workup of the particular condition. Okay. Diagnostic workup, treatment options, medications, symptoms, everything of the particular condition. Okay. So guys, while you are working in inpatient, Remember, they given diagnostic workup on the record, but they didn't mention the condition. Based on the diagnosis workup, you need to ask the condition. You need to raise the condition, okay? For suppose if they mention SOB, can you ask the condition?
Yes.
No, sir.
Yes.
No. So remember, minimum 3 indicators must support for the particular condition. In the record, minimum 3 indicators need to support. Based on the one indicator, we should not ask the query, right? If patient have chest pain, you should not raise the query for whether patient have CHF or not. Okay. Minimum 3 indicators must be documented in the record. Then only you need to raise the query for particular condition based on the clinical indicators. Okay, they didn't documented the condition. Simply they given like patient have a home oxygen, SOB, nebulization treatment. So these all are the symptoms of particular condition. Then you need to raise the query for that condition, like COPD. These are. Then patient have fever, tachycardia, WBC. These are the symptoms of sepsis. You need to raise the query for sepsis like this. So where you will get, I will share this clinical indicator, symptoms of the particular conditions. Okay. In this concept, so please note down the questions for which conditions you need to learn the clinical indicators. Sepsis. Please read these indicators. There is no option. You need to remember the indicator names of the each condition. Okay. Sepsis. Then aspiration pneumonia. Aspiration pneumonia. Anemia. Anemia. Acute renal congestive heart failure. Malnutrition. So here 7 there. No need to read acute renal failure and acute respiratory failure. Remaining 5 condition indicators you need to prepare.
Under symptoms later on, right?
All the symptoms you need to learn.
Okay.
Okay. All the symptoms you need to prepare.
Which are more important? Could you please repeat?
Except acute renal failure and acute respiratory failure, remaining 5 conditions.
Sir, share this PDF on.
Yeah, I will share. Okay, it was inpatient PDF name. Here you will get, okay. So they will ask simply, guys, in congestive heart failure, remember ejection fraction scores. Based on that, we can identify it was whether systolic or diastolic. Okay. If they given ejection fraction 35, what type of heart failure?
Systolic.
Systolic. Okay, remember, simply they will give question like ejection fraction was 35, patient have CHF. You will raise the query of acuity of the CHF or only for systolic CHF?
Systolic.
Systolic.
Okay, based on the ejection fraction, you already identified it was systolic. So you need to raise query only for systolic heart failure. No need to raise all the specific types of heart failure. Now, patient coming with pedal edema, chest pain, and elevated BNP. Based on this indicator, for which condition you will raise the query? Options like CAD, AFib, respiratory failure, CHF.
CHF.
Like chest pain, ankle edema, or pedal edema, same elevated BNP. Like this, they will ask questions. Okay. Now, patient coming with chest pain, chest X-ray taken, chest X-ray shows negative, elevated potassium levels. For which condition you will raise the query? Elevated potassium means
Hyperkalemia.
Hyperkalemia, you need to raise the query. Like this, they will ask query conditions. Okay, based on indicators. Now, patient coming with cough, SOB, and dysphagia, swallow study taken, shows normal, chest X-ray revealed pneumonia. Physician started with IV antibiotic treatment. For which type of pneumonia you will raise the query?
Aspiration.
Aspiration pneumonia. Okay, this dysphagia swallow study was the indicators of aspiration pneumonia. Remember, for only aspiration pneumonia, you will get the indicators related to digestive systems. Remaining all pneumonias, you will get only respiratory symptoms. Okay. So here, these are the things you need to remember. There is no choice. Okay, you don't get these indicators in the book. Then they will ask symptoms they will give, like patient have tachycardia, fever, and tachypnea. For which condition you will code based on these indicators. Are these symptoms related to which condition they will ask? These symptoms are related to which condition? Sepsis. Okay, you need to select the sepsis. These symptoms are related to sepsis. Like this, they will give questions. Clear? Indicator queries. So minimum 3 indicators must be support. Generally, based on the project, some projects will take 2 indicators also. I don't know exactly. Okay. Generally, 3 indicators need to support to raise the query for clinical indicator query. Clear?
Only one condition mentioned, that time only raise the query, right?
Minimum 3 indicators must support. Now, they given diagnosis workup of the based on the workup, you can raise. Suppose they given 2 to 3 workups, they didn't mention. You need to raise for that also. Document diagnosis not there, only workup there. Then only raise. Minimum 3 indicators, 3 workups, like any 2-3 symptoms or 3 diagnosis workup, medication. They given, like suppose furosemide they given, SOB given, ejection fraction they given. These are the symptoms of indicators of CHF. Okay, like that. Furosemide was the medication of the CHF. Next queries. These are clear, right, guys?
Yes, sir. Yeah.
Next, remember yes or no queries. Based on this, we need to raise how to raise the query now. Templates need, right? These are the template formats of queries. Okay, now we are what we discussing. This is yes or no query format template. So yes or no means you are giving only 2 options to the physician. Okay. Here you are giving only 2 options, whether patient have condition or not. Okay. Like, give me some example of yes or no query based on this document. POA indicator comes under yes or no query. Correct now? You will ask whether tell me the POA indicator, yes or no. If they said yes, they will give the reply. If they say no, I don't know. Okay, you will give 2 options only, right?
Yes, sir.
Pathology related query. You will give to the patient 2 options, whether that condition was present or not, please confirm. Okay. Best example of yes or no query was pathology query. You will give only 2 options for the patient, whether that pathology condition, what the documented in the pathology review, that condition was present or not. That's it, right? You need. Okay. Then you need to give 2 options, yes or no. Pathology query was the good example. Then multiple choice query. Multiple choice means you will give multiple options. Okay. You will give multiple options to the physician. You will give unlimited. Okay. There is no limit for multiple choice query options. Okay. You can give whatever you want. See, like must be choice. No specific number. Okay. There is no specific number. You can give as much as list. Suppose while you are raising the query of acute of CHF, you will give much more options, right? You need to type all the CHF related things. Okay. When the clinical indicators documented, you will mention all the clinical indicators, right? If they mention like 10 indicators or 5 indicators, you need to mention all the indicators and you need to ask the query. So there is no limit here. Okay, unlimited, no specific number. You can give as many as choice to physician. Okay, multiple choice means you will give more chances. Yes or no means only 2 chances. Yes or no, please confirm. So tell me the first question. This POA comes under yes or no or not? POA query is yes or no query acceptable or not? Yes or no query is preferable for all query formats? No, right? For specificity query, yes or no query will not work out, no?
Yes.
Okay. Only pathology POA queries you will get.
Sir.
Yes or no? Hello?
Yes, sir.
Okay.
Yes, sir.
Any doubt? No, no. Clear, right, up to now? Yes or no query? Multiple choice
Sir,
query.
explain that yes or no query one time.
Yes or no means you are giving just 2 options to the physician. Please confirm yes or no. Please tell me. Okay, best example of like pathology queries and POA indicator query. While you are document inception to identify the POA, you will give 2 options to physician. Please confirm the POA yes or no. If states, they will give POA. If provider states, I don't know. Simply. Pathology query. Whether please confirm pathology condition documented or not to the physician. If pathologist states that documented condition was present, you will go with code. If they said it was ruled out, don't go like that. You are giving just 2 options. Yes, no. Okay, directly you are asking. Tell me yes or no, like that. That condition was present or not, please tell me. Multiple choice means you will give the options and ask the condition.
Verbal
Okay.
queries.
Here, hello?
Verbal queries.
Verbal means what is the
Sir, you
voice?
are
Through
not audible,
voice.
sir.
No, verbal means what I am asking.
Yeah,
Voice.
voice.
Voice. Okay, voice queries. Written means documented queries, template fill and send. Verbal means through voice or phone call or text voice. You need to send your query. Okay. Through voice, if you are sending your concern verbal query. Through written the document and fill the template and send means written query. Okay. See, next query is important, guys. Complaint and non-complaint queries. Complaint or non-leading. Non-complaint, leading. Same meaning, okay? Leading query or non-complaint query. Complaint query, non-leading query. Okay, both are same meaning. So, when we need to raise the complaint query, when we need to raise the non-complaint query. Based on that type of, up to here queries. These are templates, okay? How we need to raise the query. Okay, when we need to raise the query complaint, when we need to raise the non-complaint query, these all are templates. Non-leading means, what is the meaning of leading?
Assigning the code.
Yeah, it was directly lead to the particular condition, correct? Non-leading means it was not leading to the particular condition. Remember, complaint or non-leading means here you will give the information to the physician and you will ask the condition. Okay, like you will give all the clinical indicators, multiple indicators documented. You will give all the stuff whatever you have, and you will ask the condition to physician or specific organism of the condition of physician. You are not mentioning the condition name here directly. You are asking the condition name. It was non-leading. You are not leading directly to the particular condition based on the sufficient information. You are complaining to the condition. Non-complaint means you are not complained here. you are directly lead to the particular condition. You are asking directly whether you have treated this condition or not, based on the indicators, whether you are giving this condition or not. Directly you are asking the condition based on the information. Suppose patient have fever, tachycardia, elevated WBC. Based on these indicators, if you ask the condition whether you are treating sepsis or not, which is complaint or non-complaint. If you are asking are you treating sepsis means
Non-complaint.
non-complaint. You are directly leading to the specific condition. Suppose the same patient have symptoms and you will ask, please confirm the diagnosis means based on the indicator. Mention the specific condition means complaint or non-leading. Correct? You people are understanding or not? Complaint and non-complaint. Simple. If you ask directly for the particular condition based on the indicators or specific data, non-complaint. You are not complaining, you are directly leading the condition. If you are not leading any condition based on the data you are giving to the patient, you are asking the condition. You are complaining here for the condition. You are not leading. You are complaining to the condition. Here you are not complaining, you are directly lead the condition. Okay?
Can you give example for complaint or non-leading?
Yeah. Now, if you understood the document, like definitions, we can practice the examples. Yes. Yeah, 25th question, check. It was not a complaint query. Wait, guys. I will check. This page not there. Yeah, see 33 question. So here they are asking, they given multiple indicators. Okay. Based on the indicators, are you agree with coding of sepsis means it was complaint or non-complaint?
Non-complaint.
Non-complaint.
Non-complaint, right? You are not complaining. It was leading directly. Suppose if you type like this, all the data and you are asking should be further specified, that is the condition. The patient condition should be further specified means you are asking the data, you are giving the data and you are asking the condition.
Complaint.
It was a complaint query. So you are giving all the clinical indicators. Hello?
Can you send this document also?
Already I shared these all before only. Okay. Everything I shared only with you. So now how you need to identify complaint or not complaint? You got it right. So you are giving clinical indicators, best example of non-complaint like sir complaint, you will give the indicators all and you will ask the condition. Okay, non-leading, you are not leading. You will give the document and you will ask the direct, you will mention the condition. Okay, you are mentioning the condition name means specifically leading. You are not complaining, you are directly leading to the particular condition. Okay, non-leading means you are not mentioning the specific condition, you will give the data. That's it. Clear? Complaint and non-complaint. Yes or no, multiple choice queries and query types.
Clear, sir.
Yes, sir.
And so these are the queries. In this concept, you will get mostly 10 to 15 questions. Okay. They will ask some, they will give examples and they will ask which is the complaint query, which is the non-complaint query based on the options. Okay.
Retrospective query అది చెప్పలేదు.
That also I will explain. Yeah. Retrospective query and concurrent query. These also.
Equity query కూడా.
Acuity or specificity, same meaning. Okay. Retrospective or concurrent means. So guys, who will raise the query?
Medical
Oh,
coder.
when you will get the document to coding? So while you are coding the document, patient was stay in the hospital or left to the hospital?
Left the
Staying in hospital.
The hospital.
You will get an entire document mean for reporting patient already left the hospital, right? You will get the discharge summary, everything, no? Yes or no?
Yes,
So
sir.
guys, remember, simple. Retrospective query means patient will left to the hospital while you are coding. Patient was not in the hospital. Okay, you will get all the data with you already. Patient was already left to the hospital. Then if you raise the query means retrospective queries, these are. So while we are doing all medical coders doing retrospective queries only. Concurrent queries means patient is on hospital. Okay, these will do CDI coders. Okay, CDI, clinical data investigation team there. Okay? These people will work for hospital side. Okay, these people will work for hospital side. Before discharging the patient, they will clear all the conflict between the document. Okay, they will already, patient was in the hospital, day by day document they will review and they will raise the queries and they will clear the conflicts between in the document. It was concurrent queries. Patient was still in the hospital. They are clearing all the conflict between the document with patient. It was conflict to query. Okay, these will do CDI coders mostly. Clear? So retrospective and concurrent means simple. Patient was left to the hospital, retrospective while raising the query. Concurrent means patient was still in the hospital, you are raising the queries. So who will raise this concurrent means CDI coders. They will directly chart clear with hospital like physician while in the hospital patient. Any doubt?
No, sir.
Yes, sir.
Thank you. Yes. Then tomorrow onwards we can go with paper. Okay.
Bro,
I'm sharing multiple practice papers, guys. So these all are previous papers. Okay. Don't neglect that papers. I shared today 2 papers. Okay. These all are previous year papers. Okay. What I'm sharing like this MCQ 24 CCS final mark test. These are previous papers. If you go through that papers, you will find some questions what I given in this current paper also, which means you will get 10 to 15 questions in the previous papers also. If you review that papers, it will be definitely well helpful for you.
bro,
Okay.
hello.
Bolo na.
Bro, the DRG value questions, most of the questions they ask you, is coming for exam or not?
what is the value of DRG? You need to mug up the DRG value. There is no option. Okay. It will
Okay.
come 1 or 2 questions.
Okay.
There is no option because we don't get the DRG values in the books. For working in the IP, based on their knowledge, they will remember. But as of now, while are not working in IP, you need to mug up. Okay. Exam based on IP, OP, all right. That's it. So clear, no? Tomorrow onwards, we can go with again multiple choice questions. Okay. Whatever you have doubts, I will clear. Okay. Don't expect me up to I need to explain and you need to read. You can start your read. Yeah, PSI and HAC also I will explain tomorrow. Okay. Nothing, guys. PSI and HAC, nothing. I shared the document, right? PSI and HAC.
Yes.
In the group. So you need to mug up that list. What is the conditions have in HAC list? That are HAC conditions. What are the conditions have in PSI list? That are PSI conditions. They will ask question like, they will give 4 options. Which of the following is HAC? Which of the following is PSC? Okay, you need to read and you need to identify the condition. That also you need to mug up. You don't get anywhere in the books. Okay. I shown examples now. What is the PHI? What is the HAC? See here how they will give question. No? So PSI means patient safety indicator. HAC means hospital acquired condition. See, after multiple choice, I will explain case scenarios once more. So suppose they given here question. So 70-year-old patient admitted for complex ventral hernial repair. While in the hospital, patient slips and falls, suffering hip fracture. While the hip fracture be identified as part of facility safety, PSI indicator, why or why not? So you need to check fall hip fracture was there in the PSI list or not. If there, it was a PSI condition. That's it. It was not there in the list. It was a not PSI. Okay. We have maximum hardly 10 to 15 conditions for PSI, 10 to 15 for HAC.
I have to mug up this, sir.
Yeah, anyway, you need to mug up. There is no option.
Okay.
Because who already working now, they will get idea. PSI, HAC, daily they are working, right? So we are not working in the inpatient means we need to mug up only. See here, which of the following is found in the hospital acquired condition list like HAC, hospital acquired condition means HAC. They given 4 codes like stage 4 ulcer, foreign body of the skin, UTI type. One condition you will identify in the HAC list. That was stage 4 ulcer. Please check stage 3 and stage 4 ulcers are HAC list.
Yes, sir.
Okay. Like this, we need to review HAC and PSA. Clear? How to identify HAC and PSA?
Yes, sir.
Yeah. Thank you. So remember, POA, CCM, CC, HAC, PSI queries all are theory. Mostly will get theory in the inpatient. They will ask basic guidelines. They won't ask much more coding. Hardly will get 2 multiple choice questions related to direct codes. Remaining all basic guidelines. Okay, which means who are working in the IP, they are need to do like that. They will ask. But as of now, our choice need to prepare.